Wanna pass the NCLEX? Then let's get started. Today we're covering myocardial infarction, 10 case study questions. Here is the patient information. Sarah Johnson, 62-year-old female, medical history of hypertension, hyperlipidemia, diabetes mellitus, chief complaint severe chest pain. Sarah Johnson is 62-year-old female with a history of hypertension, hyperlipidemia, and diabetes mellitus presents to the emergency department with severe chest pain. The pain started suddenly approximately 1 hour ago and is described as crushing and radiating to her left arm. She also complains of nausea and sweating. On examination, her blood pressure is 160/90, heart rate is 110, respiratory rate 22, and oxygen saturation 94% on room air. Cardiac auscultation reveals irregular heart sounds with no murmurs, and peripheral pulses are weak and thready. An ECG shows ST segment elevation in leads 2, 3, and AVF. Question 1. What is the most likely diagnosis for Sarah Johnson? Acute gastritis, MI, panic attack, pulmonary embolism. Pause the video and select your answer. The correct answer is B, MI. Given Sarah's presentation of sudden onset severe chest pain, associated symptoms, and ECG finding consistent with ST segment elevation, MI is most likely the diagnosis. You can pause the video and go through the incorrect options. Question 2. Which of the following is the most appropriate initial intervention for Sarah Johnson? Administer sublingual nitroglycerin, administer IV morphine, administer IV furosemide, administer IV insulin. Pause the video and select your answer. The correct answer is A. Administer sublingual nitroglycerin. Sublingual nitroglycerin is the initial intervention of choice for MI to relieve chest pain by vasodilating coronary arteries and improving blood flow to the myocardium. Question 3. What medication should be administered immediately to Sarah Johnson to inhibit platelet aggregation? Aspirin, heparin, clopidogrel, enoxaparin. Pause the video and select your answer. The correct answer is A. Aspirin inhibits platelet aggregation and is administered immediately to patients with suspected MI to reduce the risk of clot formation and further myocardial damage. Question 4. Which cardiac enzymes is most specific for myocardial injury? Creatinine kinase, lactate dehydrogenase, troponin, myoglobin. Pause the video and select your answer. The correct answer is C. Troponin. It is the most specific cardiac enzyme for myocardial injury and is used for diagnosing MI. Question 5. Which diagnostic test should be performed immediately to confirm the diagnosis of MI? Echocardiography, chest x-ray, cardiac catheterization, troponin levels. Pause the video and select your answer. The correct answer is D. Troponin levels should be measured immediately to confirm the diagnosis of MI. Elevated troponin levels indicate myocardial injury and are essential for diagnosis. Question 6. What is the primary goal of reperfusion therapy in management of MI? To prevent arrhythmias, to restore blood flow to the ischemic myocardium, to lower blood pressure, to reduce cholesterol levels. Pause the video and select your answer. The correct answer is B. To restore blood flow to the ischemic myocardium. The primary goal of reperfusion therapy in MI is to restore blood flow to the ischemic myocardium, thereby minimizing MI damage and preserving cardiac function. Question 7. Okay, guys, we're almost to question 10. What is the recommended time frame for administering thrombolytic therapy in eligible patients with MI? Within 30 minutes of arrival to the ER? Within 1 hour of arrival to the ER? Within 12 hours of symptoms onset? Within 24 hours of symptoms onset? Pause the video and select your answer. The correct answer is C. Within 12 hours of symptoms onset, thrombolytic therapy should ideally be administered within 12 hours of symptoms onset in eligible patients with MI to maximize its efficacy in dissolving coronary thrombi and restoring blood flow. Question 8. Which of the following medications should be avoided in patients with acute MI due to its negative inotropic effects? Metoprolol, nitroglycerin, dobutamine, furosemide. Pause the video and select your answer. The correct answer is C. Dobutamine is a positive inotrope that increases myocardial contractility and is typically avoided in patients with acute MI due to its potential to exacerbate myocardial ischemia and arrhythmias. Question 9. What is the purpose of administering IV furosemide in the management of MI? To reduce preload, to increase myocardial oxygen demand, to inhibit platelet aggregation, to relieve chest pain. Pause the video and select your answer. The correct answer is A, to reduce preload. Intravenous furosemide is administered in MI to reduce preload by promoting diuresis and decreasing fluid volume, thereby reducing cardiac workload and myocardial oxygen demand. Question 10. Which of the following statements regarding patient education following MI is correct? Exercise should be avoided completely to prevent reoccurrence. Smoking cessation is not necessary if the patient is already on medications. Medication adherence and lifestyle modifications are essential to reduce the risk of recurrent events. Dietary changes are not necessary if the patient is taking statins. Pause the video and select your answer. The correct answer is C. Medication adherence and lifestyle modifications are essential to reduce the risk of recurrent events. Patient education should emphasize the importance of medication adherence, smoking cessation, healthy diet, regular exercise, and stress management to reduce the risk of recurrent cardiovascular events. Congratulations! You just answered 10 case study questions based on myocardial infarction. Click that subscribe button and join us next Wednesday.